Pierre Poilievre, leader of the Conservative Party of Canada, has repeatedly stated his support for Canada's universal public healthcare system. He has not explicitly endorsed a complete shift to an American-style private model. Poilievre's public statements emphasize his commitment to maintaining publicly funded healthcare for all Canadians. He acknowledges the importance of this system as a cornerstone of Canadian identity and social fabric. However, Poilievre also advocates for significant reforms within the existing public healthcare framework. He argues that these reforms are necessary to address persistent challenges like long wait times and difficulties accessing specialized care. His proposals center on introducing market-based solutions and increasing private sector involvement to improve efficiency and patient choice. Poilievre's stance has sparked debate across the political spectrum. Supporters view his approach as a pragmatic way to strengthen the public system without dismantling it. Critics express concern that his proposals could lead to a two-tiered system, potentially undermining the principles of universality and equity. Poilievre's Blue Seal program aims to create a national certification system for healthcare professionals. This would facilitate greater mobility across provincial borders and address regional shortages. Streamlining credential recognition for foreign-trained professionals is also proposed. These reforms aim to reduce wait times and improve access to care. Poilievre believes these changes can enhance efficiency while preserving universal public health care. Critics, including members of the New Democratic Party and the Liberal Party, have raised concerns about Poilievre's stance on healthcare. They point to his past voting record and his ideological leanings as potential indicators of a hidden privatization agenda. Specifically, they highlight his time within the Conservative government of Stephen Harper from 2006 to 2015, during which private healthcare experienced some expansion. During that period, the federal government did not impose penalties on provinces that allowed for out-of-pocket payments for certain medical services, a departure from previous practices. Poilievre's voting record also shows opposition to the introduction of new social programs like national pharmacare and dental care. He voted against a $196.1 billion funding package in 2023 that was contingent on provinces making progress on these programs. Furthermore, critics point to a 2012 vote where Poilievre supported $43.5 billion in cuts to projected health transfers to provinces. While these cuts were framed as necessary austerity measures at the time, opponents argue they demonstrate a willingness to reduce public spending on healthcare. Adding to the skepticism, Poilievre has faced accusations of dodging direct questions about his plans for private healthcare. Despite the criticisms and concerns, it's important to note that Poilievre has not explicitly proposed dismantling Canada's universal public healthcare system and replacing it with an American-style model. He has not advocated for scrapping Medicare, introducing widespread private health insurance, or directly charging Canadians for core medical services. Poilievre's current proposals focus primarily on reforms within the existing public system. He maintains that these reforms are essential for improving efficiency, reducing wait times, and ensuring Canadians have timely access to quality care. However, critics argue that, without clear safeguards and a firm commitment to maintaining public funding, his proposals could erode the principles of universality and equity that underpin Canada's healthcare system. They contend that a gradual expansion of private healthcare within a predominantly public system could lead to a two-tiered system where those who can afford it have access to better and faster care. The debate over Poilievre's healthcare stance unfolds against a backdrop of strong public support for Canada's universal public healthcare system. Polls consistently show that a significant majority of Canadians value and want to preserve this system. A 2023 Angus Reid poll found that only 28% of Canadians support introducing private options within the healthcare system. This strong public sentiment in favour of public healthcare suggests that any attempt to significantly dismantle or privatize the system would be politically risky. While Poilievre currently leads in the polls with his Conservative Party at 41% support, His personal approval rating remains low, with a 52% unfavorable view, according to a March 2025 Daily Sabre poll. This suggests that while Canadians may be dissatisfied with certain aspects of the healthcare system, they are wary of radical changes or a shift towards a more private model. Poilievre's challenge lies in convincing Canadians that his proposed reforms can address their concerns and improve the system without undermining its core principles.